public reporting has been a catalyst for change in our community. We needed to be able to collect that information, analyze that information in order to figure out where do we need to go within our community to improve that quality care. So one of the first things it provided was allowing physicians to kind of look at their own practice. How am I doing? That then led to the next step of connecting with other providers. Hey, you're doing really well in this area, I'm not. What are you doing? What's working for you?
What is helpful is that they give our doctors scores, and then they say, in Southeast Michigan, the average preventative screening rate for mammograms is 80% or 70%. We can then compare to where we're at. Then we look at the providers that are low, and we say, what could be going on?
And the great thing about having the performance reporting is they can see it. And it isn't the numbers then that matters to them or what their score was. It's knowing that those patients are going to be better off because they've achieved those goals that are going to help them avoid serious complications of diabetes or vascular disease.
And what's incredible is when you gather up a set of measures that the providers will acknowledge are accurate, or reasonably accurate. And then you just basically put, for us, we have everybody's diabetic scores, prevention scores that are on our intranet. And so they can see how they're doing relative to the rest of the clinic, one clinic against another. And generally, docs are motivated to change if they see they're not at the top of their game.
When I got the survey back, I wasn't particularly very happy with how we did. I thought we were doing a much better job than what we were originally doing. Willingness to recommend, we were 3.5 out of 4 stars, but we weren't happy we weren't 4 out of 4. So we had to set to work on what were we going to do to improve this.
One of our group's health partners in one of the more inner city areas has a very large Somali population, so they were frustrated that they couldn't get a higher result on breast cancer screening. And because of the measurement that they were doing, approached a focus group of those women and asked what some of the barriers were and identified if they would do same-day appointments that they could get a higher rate. It's about what you can do with the information to actually make changes for your patients.
A great example is one practice, a very good practice of general internists who had quite good quality measures in diabetes, except for pneumococcal immunization. For some reason, their practice was not doing a good job ensuring that their patients with diabetes got immunized. So this is a six-member group, and they decided that they would focus on that issue. They geared up the office, they worked with the medical assistants, the receptionists, so it was a campaign over the course of a year, and they improved their measures something like 20% in a year.
But because it's being used more and more, we're getting physicians calling us about how to make them better, which is exactly where we want to be, is more discussion about how do you get better measures and not so much should we be doing this or not.
So to me, that's the most exciting story, is that we've created something that's useful to providers and they're using it to improve care.